Hello again, everyone. My name is Tina Otti. I'm a registered nurse midwife and childbirth educator. Today, I'd like to talk to you a little bit about an unexpected niggle of pregnancy, and that is issues around your mouth and mouth care. Three things that we're going to look at is gums, bleeding gums, swollen gums. We're going to look at increased saliva in your mouth, which might surprise you. And then we're going to also talk a little bit about bad breath. So what can you expect from your mouth and the changes in your mouth during pregnancy? Well, once again, due to hormonal changes in the body, it's very normal for the gums in your mouth to become engorged and swollen. And when that happens, you might have more food that gets trapped in your mouth, and you're at a higher risk of getting something called gingivitis. So what you need to do is use a softer brush. Don't brush too vigorously. And if you get nauseous, which happened to me when I was pregnant, if I brushed too close to the back of my mouth, I got the feeling of wanting to vomit. I used a mouthwash for, as well as a toothbrush and toothpaste twice a day, in fact, sometimes 3 times a day. So flossing is important. The use of mouthwash is important. Increasing your calcium intake is important. And then ferrum phos is a homeopathic preparation that you can use as well to strengthen your gums. It's important that you see a dentist once during your pregnancy and an oral hygienist possibly twice, at least once, if not twice, just to check your gums and just to see that there's no decay or cavities, because it could cause a problem with your developing baby. The other thing that might surprise you is, in fact, excessive saliva. And we're not quite sure why this happens during pregnancy. Some women actually have to walk around with a tissue that they spit into because they've just got the saliva that builds up in their mouth. What might cause this is if you're experiencing a lot of heartburn, because heartburn triggers certain receptors in your stomach to produce more saliva. And then nausea is one of the other things. Often with vomiting comes a lot of saliva, because saliva is your friend. It lubricates your mouth. It produces enzyme that help with digestion. It's antibacterial, it's antiviral, and it's antifungal. So saliva, too much saliva is a problem, but saliva is our friend. So this is quite important for you to understand, that it's not necessarily something wrong, but it can be a niggle that can drive you absolutely crazy. Bad breath usually comes from a mouth that is not moist. So keeping your mouth moist is quite important. How do you do that? You can suck on peppermints, you can suck on dry, hard sweets, or a drop of lemon on your tongue once or twice a day when you're really, really struggling. And then also chewing on sugarless gum will help as well, just to keep that saliva there in your mouth, and especially during labor as well. When you're breathing hard, your mouth is open a lot, and you get a very dry mouth, and then that's when the bad breath can settle in. So I hope these few little tips have helped you, and also to let you know that it's common during pregnancy. This particular niggle not as common as some of the others, but it might surprise you, and that it's not, you wouldn't be the first person to have excessive saliva. Bleeding gums is so common. Don't worry too much about it. Just use that soft brush and make sure that you see your dentist just to check that everything's okay. Remember, your baby's raiding your body for all your nutrients, and you need to look after your teeth.